Our next topic is cleaning and shaping of the root canal system. The endodontic treatment, it consists of three steps. The one is the cleaning and shaping of the root canal, second disinfection, and third is the obturation. Out of these, the cleaning and shaping, it is the one of the most important step in the root canal therapy. So what is cleaning? It consists of removal of all the pathogenic potential contents from the root canal system. What is shaping? The final preparation of this system should be exact replica of the original canal configuration in the shape, taper, and flow. The biomechanical preparation of the root canal system was first given by Dr. Schilder. According to Schilder, he gave 5 mechanical objectives for successful cleaning and shaping of the root canal. The first is the root canal preparation system should develop a continuous tapering cone. So this shape should mimic the natural canal shape. So the access cavity and the root canal preparation that should form a continuous channel. Second, making the preparation in multiple plane that introduce the concept of flow. So this objective would preserve the natural curve of the canal. Third, making the canal narrower apically and widest coronally. So that will create a continuous taper up to the apical third that will create the resistance form to hold the GP in the canal. The fourth is to avoid the transportation of the foramen. There should be gentle and minute enlargement of foramen while maintaining its position. And the fifth is keep the apical opening as small as possible. So these were the 5 mechanical objectives by the Schilder. Now let us discuss the different movements of the instruments that are used while the root canal preparation. The first is the filing motion. The filing is also known as push and pull action. So the push and pull action is filing, that is powered by the inward passage of the file. It is powered by the hand and the rigidity of the file. So this is an effective technique with the H file, as they do not engage during the insertion action and cut efficiently during the withdrawal motion. What are its disadvantages? With H file, one can easily cut the middle of the curvature and you may cause strip perforation. So filing motion, remember, it is the most commonly used for the canal preparation, but it may lead to canal ledging, perforation and other procedural errors. Other is the reaming motion. So what is reaming? In endodontic practice, the reaming, it is commonly done by the use of reamers. So the reaming motion that consists of clockwise rotation of the instrument. The instrument may be controlled from the insertion to generate a cutting effect. Other motion is turn and pull motion. It is a combination of reaming and filing, where you insert the file with 1/4 turn clockwise and inward directed hand pressure. Positioned into the canal by this action, the file is subsequently withdrawn by using filing motion. Other is watch winding motion. It is the back and forth oscillation of file that is done with the 30 to 60 degree right and 30 to 60 degree left as the instrument is pushed into the canal. So this is a back and forth movement that causes the file and reamer to plane the wall efficiently. Other is watch winding and pull motion, where the instrument, it is moved apically by rotating it right and left through an arch. When it feels resistance, it is taken out by the pull motion. It can be used with the H file. Other is the balance force technique. Here you insert an instrument and it is rotated to right, that is clockwise direction a quarter turn. that will pull the instrument into the canal and position the cutting edges into the wall. After that, it is rotated left to the counterclockwise at least 1/3 of the revolution to unthread the instrument and drive it from the canal. What are the advantages of this motion? So you do a simultaneous apical and counterclockwise rotation of the file that strike a balance between the tooth structure and instrument elastic memory. So this balance locates the instrument very near the canal axis. Even in the severely curved canals, this technique avoids transportation and it works effectively without pre-curving. Now these are the standard approach that we use, and various authors who discovered that. The first is the standardized technique discovered by author Engel, step back technique by Clem, all step down technique, Marshall and Pepin step down technique, Gorig double flare method, Fava crown down pressureless technique, Morgan. All that you have to remember for your entrance point of view. Let us discuss the technique of the root canal preparation. Two approaches that are used for the biomechanical preparation. One is the step back technique, other is the crown down technique. In the step back technique, that starts at the apex with the fine instruments and working up to the orifice with the progressively larger instrument, whereas in the crown down technique, that is starting at the orifice instead at the apex with the larger instrument and working up to apex with the larger instruments. So the apical to coronal technique, they are conventional technique, step back technique, modified step back technique, or passive technique. Whereas the coronal to apical technique, they are step down, crown down pressureless, hybrid technique, double flare technique, modified double flare technique, or the balance force technique. The first is the conventional technique or the standardized preparational technique. So it is done in the narrow canals with circular cross section. The working length is determined. The smallest instrument used adjusted to the working length and sequentially we enlarge the entire canal. Other is the step back technique, also known as telescopic technique or serial root canal preparation technique. So this technique emphasizes keeping the apical preparation small in the original position and producing a taper coronally. Klein was first to describe this technique. According to Moulin, he divided the step back preparation into two phases, phase 1 and phase 2. Phase 1 is the apical preparation, that is starting at the apical constriction, and the phase 2, it consists of preparation of the remainder of the root canal, gradually stepping back while increasing in the size. Third is the refining phase, where we do the refining of the root canal. So the phase 1 consists of preparation of the apical constriction, establishing the working length, insert the instrument with watch winding motion, remove the instrument and irrigate the canal, repeat the process until a 25K size file reaches the working length, and recapitulate between the files. Next is the phase 2. In the phase 2, we prepare the remainder of the canal. So place next file 1 mm short of the working length, like up to 25 number file we use till the working length. The 30 number file, it is used 1 mm short of the working length. After 35 number file is used with the 2 mm short of the working length. After 40 number file is used 3 mm short of the working length. Gradually 45 number file used with the 4 mm short of the working length. After that 50 number file is used for the canal preparation. For the middle part, we can use GG drill to prepare the mid root area. So in the step back preparation, it will create small apical preparation with the larger instrument used at the successive decreasing length to create a taper. What are the disadvantages of step back technique, it is difficult to irrigate apical region. There are more chances of pushing debris periapically. It is time consuming. There is tendency to straighten the curved canals. There are chances like ledge formation, zipping at the apical area, apical broking, etc. Other is the modified step back technique. In this technique, the preparation is completed in the apical third of the canal. After this, the step back procedure is started 2 to 3 mm short of the minor diameter, that is the apical constriction, so as to give an parallel retention form at the apical area. So with this technique, there will be less chances of apical transportation, increased chances of canal walls being planned. Disadvantage includes accumulation of debris in the canal. There may be change in working length because the coronal constriction is removed at the end. Other technique is the passive step back technique. It was given by Tora Benazid, that involves the combination of hand files and the rotary files to attain adequate coronal flare before apical root canal preparation. So it involves the combination of hand and rotary instruments. The number 15 file is used passively to determine the working length. Then 20, 25, 30, 35, 40 files are inserted passively. After that, number 2 GG drill is inserted till it feels resistance and it is activated. Then number 3 and 4 GG drills are used. And finally, 20 number file is inserted into canal up to the working length, and the canal is prepared by filing with instrument short of the working length. Next are the coronal to apical approach. So this technique permits straight line access to the apical region, eliminates the coronal interference that allow better determination of apical canal size, remove the bulk of tissue and microorganism before the apical shaping. The working length is less likely to be changed. The greater volume of irrigants they can reach in the canal irregularities in the early stage of canal preparation because of the coronal flaring. What are the disadvantages of coronal to apical approach? It may be more time consuming than the step back technique. Excessive flared preparation in the coronal and middle third may weaken the tooth. The use of end cutting rotary instrument in small or partially calcified canals may predispose to perforation as the instrument move apically. So here the technique used will be crown down technique. It is also known as reverse flaring technique by Vane, coronal 2/3 pre-enlargement by the Cohen, and cervical flaring technique by Gurridge. So it consists of two phases, phase 1 and phase 2. The root canal preparation is penetrated using H file of size 15, 20, 25 to 16 to 18 mm or where they bind. That is the phase 1 stage. In the phase 2, JG drill are used. Number 2, 3, 4 are used sequentially shorter, thus flaring at the coronal segment of the root canal, and that is followed by the apical instrumentation that involves the two steps, step 1 and step 2. In the step 1, we determine the working length and creation of apical stop of the size number 25. The shaping of the remaining canal in the step down approach using descending file sequence, progressing 1 mm per consecutive instruments apically. What is cork bottle appearance in the radiograph? One should take care to avoid all the GG drill to the same level. That may lead to excessive cutting of the dentine, weakening of the roots, and that gives a cork bottle appearance in the radiographs. So this is a figure showing the cork bottle appearance in the radiograph due to the excessive use of the GG drill. Other technique is double flare technique or hybrid technique that combines the step down and step back technique. The coronal preparation is prepared by step down technique, and apical preparation it is completed with the step back technique. So it is indicated for the straight canals. For straight portion of curved canals, it is contraindicated in the calcified or the young permanent teeth with open apices. Other is the canal master technique. It uses the modified root canal instrument in coronal apical approach.